today for our webinar on youth and gender dysphoria, I want to introduce our host, Penny Tilby. Penny Tilby is a retired clinical psychologist. She's worked with people of all ages, all age groups in both hospitals and community-based mental health facilities. She's been active in unions, feminist and pro-choice organizations, and was for many years involved with the Canadian Centre for Policy Alternatives and the Council of Canadians. And I want to thank Penny for hosting today. So take it away, Penny.
Okay, thank you, Chris. Good morning, everybody, or good afternoon, depending on where you are. We're delighted to have with us today two psychiatrists who have closely studied the phenomenon of gender dysphoria in children and youth. As you know, there's a lot of controversy about the best way to respond to kids who are anxious about their gender. Very well-intentioned people, parents, teachers, doctors, etc., all want to support these children, but the best way to do that is currently under significant debate. Dr. Susan Bradley is a pioneer in this area with a wealth of experience. She was the founder of the first gender identity clinic in Canada for children and adolescents at the Clark Institute of Psychiatry in Toronto, way back in 1975. She was for 10 years psychiatrist-in-chief at the Hospital for Sick Children and head of the Division of Child Psychiatry at the University of Toronto. She has conducted clinical studies on these young people, written books, and published many articles in medical journals. She also has a special interest in children with high-functioning autism, which we'll hear is relevant to our discussion. Dr. Joanne Sinai is also a Canadian psychiatrist who graduated from the University of Toronto. She practices in Victoria and is in addition a clinical associate professor at UBC. She has many publications in peer-reviewed journals and has recently been following research from around the world on gender dysphoria, research which is helping us to better understand how the disorder arises and how we can assess and treat these children and youth without causing harm. Both these doctors have been doing what very few professionals have been willing to do, examine the data and then speak up publicly about their concerns. If we want to help these young people and avoid harming them, there needs to be good research to support all the actions we take. Unfortunately, people who question current practices, even when highly qualified to do so, are often shut down and even vilified. So we very much appreciate these two women for taking the time to share their knowledge with us today. So for starters, Dr. Bradley, could you explain briefly what we mean by gender dysphoria? You saw hundreds of kids with gender anxiety over the years. How did you go about assessing them, and what did you learn about the factors contributing to their distress?
Gender dysphoria is a more recent term. The earlier term was gender identity disorder, but fundamentally we're referring to kids, both children and teens, who do not feel comfortable in their sex of origin, and we, after having opportunities to see these kids for many years, have begun to realize that this is basically a psychological problem, not a medical problem, and that's why we are arguing publicly and otherwise to ensure that those individuals who are coming to us are really thoroughly assessed, and that's something I know Joanne does and can talk more about. But it involves really understanding what could go on in a person's mind to have them decide they don't like who they are in a gender or sexual way. And when we started, there was very little literature. When I speak of we, Ken Zucker, who was a student with me, I think in the very first years of the clinic, has become, I think, the most prominent researcher in this area. And he has been persistent and consistent in doing everything one can do to really understand the journey, what these kids present with, and what seems to be ways of being most useful to them. We didn't have any guide when we first started in terms of what we might call them, but I knew there was something radically different about these children, even the young ones. And I ended up calling them borderline personality disorder. That is not a term that was supposed to be used for children, but I couldn't find anything else which dealt with the fact that they had a lot of difficulty with what I'll say is emotion regulation. They were often having meltdowns and things like that. And it really helped when I got my head around all of that to understand that that was central to what was happening, and that they would get very distressed about different things. They had social understanding difficulties and often would misinterpret things. One of the kinds of things that I remember recalling frequently is that if parents had an argument, these kids would often assume that this was, a really big fight, and sort of start to say, "Mommy never wins," and things like that. And so we were finding variables that we could suggest, the parents might try to look at, do something about. But in fact, the children overreacted to these things. It wasn't that the parents were necessarily not good parents. And over time, Dr. Singh was one of our interns. She followed up the population of boys that we'd seen when they were very young into the late teens, and more than 90% of them had, excuse me, decided that they were gay. And we began to realize that was common. We weren't doing anything to suggest that they should be anything else. And so it really helped us when more people got into the act and started looking at these kids more closely. And we now know that nearly all of them that present are probably best described as being in the high functioning autism spectrum. And they are not visibly autistic, and many of them are very bright, but they have all the difficulties with social understanding and rigidity and sensitivities that are common in the group of these kids. And that makes them very vulnerable in school because other kids don't always understand them. And they can feel quite left out and isolated. And as they go on into adolescence, that characteristic really makes them feel there's something fundamentally wrong with them. And they can often feel left out in those peer groups as well, and desperately want to be accepted and part of somebody's group. And so what I'm getting to at this point is how the picture has changed over time, where we're now seeing more adolescents having difficulty. And that, in my mind, comes really from the fact that those adolescents who were really wondering what was wrong with them got on the web and found that the trans activist message was very loud and clear. If you ever thought you were trans, you must be trans. And so they quickly found themselves being accepted in that role. And that has led, I believe, to the really large increase in kids, especially girls. Because when we first started, we were seeing 4 boys to every girl. But now, as teenagers, it's much more girls than boys. I'm going to stop for a minute because I've got myself into my coughing mode. Sorry.
No, what you say is very interesting, Susan. Sorry, Dr. Bradley, because this increased number of kids, as you say, are now being identified immediately or labeled with this term. So, Dr. Sinai, what do you think of the notion that these kids should be affirmed, which seems to be the current practice? As soon as a young person says, that's what I'm feeling, in schools, there's a requirement that teachers, that parents, that everybody immediately say, that's right, we'll accept what you say and we'll treat you that way. We'll maybe change your name and your pronouns if that's what you want. What are the risks of that approach, given everything Dr. Bradley's just said?
So I think we have, as Dr. Bradley mentioned, the 2 groups, the younger onset prepubertal and the later onset, but there's also being an increase in the younger onset. And one of the reasons that there's an increase in the younger onset is throughout all of the schools, there's been this intrusion of the idea that you could be born in the wrong body. So kids might be read books about being born in the wrong body. We have Jazz Jennings in the book I Am Jazz. Jazz had a very public reality TV show from when I think she was 4 or 5 years old up until now she's in her 20s. So this has become normalized in the school system that you can be born in the wrong body. Even recently, I heard about sex education where they were, and this is for 9 and 10-year-olds, talking about bodies with external parts and bodies with internal parts. Like, puberty is confusing enough. How are they supposed to understand that? So what has happened is at the very level of the public schools, they are detaching sex from gender and making it normal that you could be born in the wrong body. You could be a different gender. And we're not just talking 2 genders. There's, I don't know how many genders there are. They just keep coming up with new ones. There's male, female, non-binary, demi-boy, demi-girl. I don't even know what they all are. And when these kids come out to the schools, yes, the schools are supposed to start using whatever pronoun they want and whatever new name. And in many cases are hiding this from parents. But for the kids who go to their parents, I think right now, particularly in Canada, liberal people in particular have been so, and I'm a liberal person, I'm the exception as to being a liberal person who is questioning this, but liberal person have become to believe that there is something as true trans, and if your kid tells you that they're born in the wrong body, that they are born in the wrong body, and that you should then affirm them. The problem is, if you take a 3 or 4-year-old, they don't really understand these concepts. And what we have are these feminized boys or, tomboy girls who would probably grow up to be gay and lesbian. And now, rather than just letting them be and letting them evolve naturally, they're being told, you're really a girl or you're really a boy. And all of a sudden, they're given different pronouns, given different names. And like the whole family's in on this, the whole school is in on this. And little kids easily pass for whatever gender they want to be. But the problem now is they've made them terrified of puberty and growing up and having their bodies changed. And they also they lose the experience of growing up and just being allowed to be in their sex. And so the risk is when you start to affirm them when they're really young, that there's going to be no choice because they're going to be so terrified of puberty that everyone's going to want to put them on puberty blockers, and the kids are going to be begging for this. So social transition, and this was in the CAST review, is not a neutral act. It is something that can put the kids on the pathway towards lifelong gender transition and need for medication, because these kids, basically are living a lie, and then they hit puberty, and it's very hard for them to then, how can they turn it back? on their own. It would be very, very difficult for them to turn it back on their own. And it's a little bit more challenging when you start to get to the older kids, the teens, or even the young adults who are doing this, because they can do this on their own. They can, tell the schools on their own, the parents on their own. It's hard to then say, no, we're not going to do this, because I think really what the parents of these little kids should be doing is not changing names, not changing pronouns, reinforcing this is your sex. Everybody has different parts, and letting them wear what they want, whatever haircuts, play with whatever toys, and just celebrate who they are and let them grow up without trying to give the message. It gets a lot more trickier with the adolescents who are now on the internet, who are now, there's a lot of social contagion. And one of the things that is also happening is that this idea of being like heterosexual, cisgender is kind of boring. So, and I think that a lot of these kids, they are on the autism spectrum. And I think even like the CAS review and other research, at least about 30%. But there's lots of other reasons that they're having gender dysphoria, like do they have a history of abuse, anxiety, depression, all kinds of other mental health issues. And often they're from the families, which are less intact as well. And even in Canada, our own, Trans-Can Youth study, like I think something like 19% of the kids were Indigenous. And considering there's only 4% Indigenous population in Canada, this is huge. So we're also taking the children who have the most chaotic lives and then trying to say that this one thing will fix you. And of course, we're now in the informed consent model where you just say who you want to be, and there's very little assessment. And Susan, you had said that I'm part of doing assessments. I don't assess gender. I see a lot of people with gender dysphoria, and some of them are on, cross-sex hormones. Some of them are on puberty blockers. Even like at 19, they're still on puberty blockers. Some of them have had surgery, but they're coming into my clinic and I'm just assessing them for whatever they're in my clinic for, which is often depression, anxiety, a lot of them for borderline personality disorder, because we have a DBT clinic. So nobody's actually assessing these people for their gender and trying to understand what it is. That is just not happening. And, it's certainly not happening in psychiatric clinics, and it's not happening in the gender clinics, because there's also then the risk you're going to be accused of conversion therapy or trying to convert them if you start to ask questions.
It's interesting. I remember at one point, young people were showing up at family planning clinics in the US and being given, without any assessment whatsoever on their request, puberty blockers or hormones. And they were young teens and going out with their prescription in hand without any kind of assessment. It seemed to me that part of this arose from the well-intentioned people we had. Once the gay issue was out there and we all started to accept homosexuality as a perfectly normal thing, it's not a mental disorder, we affirm immediately, without danger, kids who are on that path. What people don't seem to realize is that it's not a parallel situation. Affirming leads to what you've just both said. And what I've gathered about current practice is that a child who's starting to go on down this path, all they require to be sent to a gender clinic is an assessment, perhaps 1 or 2 sessions with a therapist of some kind, unspecified, not necessarily a specialist in this. And if it's ticked the box, off they can go. And when they get to the gender clinic, who they meet is a nurse to start discussing medication. As opposed to my understanding in my early days in practice, when I had, I think, 2 young people that I sent to gender clinics, was there was a comprehensive assessment that would happen there. There was a thorough one, more along the lines you're talking about. And some have suggested we need, with young children, comprehensive assessments of their school situation, their family situation, is there homophobia in their family, et cetera, et cetera. It takes a long time to really know what's going on. So can you tell me a bit about what happens once affirmed and showing up in a clinic, say in Vancouver or anywhere in BC? what happens if they go in without that formal assessment, and what is likely to happen in that path?
So I guess I will answer since I'm in BC. So I will say that I got to sit in on a presentation to psychiatry residents where a psychologist who does assessments of pre-pubertal or early puberty kids for puberty blockers talked about her approach. And at the end of the day, she had said that in 2019, she did 49 assessments for puberty blockers with kids and their families. And out of these 49 assessments, she approved 49 out of 49 for going on puberty blockers. And this is not detailed stuff. And she said, well, what's the risk? Because people are looking at these as a pause, but it's not a pause, because what we now know is it's part of, the social transition goes into going on blockers, goes into going on cross-sex hormones. And you go to these clinics and the parents are expecting the blockers and the physicians are expecting to do the blockers. I know that in the 10 clinics in Canada, only 4 of them actually insist on any kind of psychological assessment before they enter the clinic and get prescribed hormones. And that's their own data. I think one is sometimes 4 request it and the other 5 do not. So there's not a lot of attention at all paid to any kind of real psychological assessment. And, one of the things that I also want to really emphasize is the long-term risks of being on these medications, which I don't think are being presented to the parents. We know that puberty blockers can cause all kinds of problems with bone development. We know that, they want to give them to kids at the first sign of puberty. So they're probably going to not be able to have children. They will be infertile. And there's a good chance of sexual dysfunction, particularly in boys, and anorgasmia. In the boys who might want to go on and have surgery to create a neovagina, there's not enough penile tissue, and then they have to use parts of the bowel. And then, of course, that's very risky, and it makes the surgery much riskier. But on top of that, we don't know what puberty blockers are doing to the brain. Puberty is a huge cascade of all different kinds of hormones on the body and the brain. And nobody really knows what it's doing to the brain, what kind of effects it can have. And also in terms of cross-sex hormones, the longer you're on them, like female bodies are not made to have high levels of testosterone, and male bodies are not made to have high levels of estrogen. So you start to increase risks of blood clots, heart disease, different kinds of cancers, stroke. I mean, these things are not negligible, and I think they're really minimized at the clinics. And I also think that if you're thinking about the kids going on puberty blockers, given that none of the systematic studies so far have shown that they've all shown that there's, very low evidence for benefit. What you're essentially saying is there's very little evidence of benefit. They haven't done the studies to show there's high risk, but we know what can happen. And this is a lifelong medicalization. Who can actually provide informed consent? Because I do not think parents can provide informed consent for cutting a kid's sterility or sexual function or changing their brains. And I don't think teenagers really have the capacity to understand what it is that they're doing either, in part because a lot of them are part of this social contagion. And I don't think they even have the capacity to understand they're part of a social contagion. So that means there's really very little informed consent. I don't think that's possible until adulthood and after the brain has matured. So after 25, 26.
What would you comment about that, Dr. Bradley?
Well, I agree with everything that Joanne is saying. The other factor that we're becoming more knowledgeable about is that more than 90% of the kids who are put on puberty blockers go right on to cross-sex hormones. And once they're on the cross-sex hormones, they're into real medicalization, because it's not far off that they will be looking at some sort of surgery on their body. And that obviously is completely irreversible. So the track that they get on is something that you can't just turn it around. And one of the things that I've tried to do when speaking to endocrinologists and others is the Hippocratic oaths suggests that you say, you swear that you will do no harm. And I do not think that legitimately those people who are doing this can swear that they're doing no harm, because it's really a path that's very hard to get kids off. And then you get into the kids who have transitioned, and after a few years, a large number of them, we're having trouble getting data on this. And I think part of it is it's very hard for those individuals to say they've made a mistake. It's such a big mistake. And but the ones who have been able to talk about this when they want to detransition have been making it pretty clear that they felt they weren't supported when they were entering into this thing, in terms of the knowledge that they would have now, or know what to expect, or even that they could have understood it. And so to me, this is a trajectory, and nearly all of the clinics throughout Europe have accepted the findings of the CAS report, which was we should not be doing this for children before age 16 at least. And it's I think wise, and even some have gone beyond that, because it's not clear that even 16-year-olds can honestly appreciate what kind of roadway or belt they're getting on that they can't just turn around and go back on. And it's always educational for me to listen to the detransitioners who really are feeling that they've been hard done by, which is just very unfortunate. So
it's a very bizarre phenomenon to me in medicine that any child or adolescent or even adult could walk into a doctor's office and say, this is what's wrong with me. I want you to fix it. I know that this is what's wrong. No, we don't do that. And if you think about some of the other disorders young people have, if the very skinny girl comes in and says, I'm fat, I need to do something about this, we do not affirm her skinniness. So fatness, I should say. So it's the weirdest thing. And it seems to be all tied up with this desire to do the right thing, so that good people, so many good, caring people, are not understanding these issues and are supporting this very dangerous process, and feeling very upset with people like you who challenge it, because you seem to be challenging their democratic sort of values. And to put it in current terms, you're Trumpian, is in a lot of people's mind. And when you look at the Trumpian fashion group, they're also opposed to sex education. They're often opposed to gay rights. And so we're totally not in the same camp, but we tend to be lumped in there. What's been your experience of the deplatforming that's happened when you are two of the people who are speaking out on this, but we see the pushback all around the world, just massive, on anyone who speaks out and questions this. What are you noticing about the effects of that in your careers?
Van, do you want to comment?
Sure, go ahead.
Oh, I'm suggesting you go ahead.
Oh, you want me to go? Oh, sorry.
Yeah.
So I think that probably there are very small groups of people who are very passionate about this, who make a lot of trouble. And I think it's probably taken, in some ways, decades to infiltrate, say, the school system and the SOGI curriculum, where all of a sudden it's about gender, not about sex, where you have, the genderbread man and the gender unicorn. All of these things have taken a lot of time. And I think it's been, a concerted effort and decades in the making. And I think that's why we find that it's so hard for people to start to change their thinking, because a lot of people don't understand that this is an ideology and that there's no biological basis for identifying, whether people are actually true trans. And in fact, none of the clinics at all ever can figure out, meeting a kid, which ones would grow out of it and which ones wouldn't. So, if you treat 100 children, on the off chance one of them might have done better. And I think that there are some adults, for whatever reason, who have the surgery and go on the hormones and they do better and they do well. But most of these people actually transitioned as adults. They've had a chance to live a life, have experience, and I think they have a different kind of consent. The problem is, because of these large groups of people speaking against it, it's very hard to get any traction, say, even at the university level, to be able to, I know that for me, there were 6 articles in the BC Medical Journal, which were all, pro-gender affirmation. And along with one of my colleagues, I wrote a letter to the editor that ended up being published, which, said some of the facts and some of the concerns. And at that point, I think Finland had the systematic reviews in Sweden, but it was before CAS. And one of, our then psychiatry residents took great offense, and she wrote something against me, which was so full of misinformation. But, there was a group of people, and I think younger people are more like that, who I haven't felt free necessarily. And I feel like I have to be careful. Certainly, we're not necessarily free to. I would love to present this at Grand Rounds again, but I've been told it's too controversial a topic. I'm like, I'm presenting facts and evidence.
Well,